I am Grady Colleen in the CapeCod.com News Center, joined today for a special piece on World AIDS Day that is December 1st. I'm joined today by a healthcare provider from the Outer Cape. Do you mind just introducing yourself for our listeners?
Hi, I'm Jeffrey Schaefer, and I'm a nurse and program manager for Test and Treat at Outer Cape Health Services in Provincetown.
All right, awesome. Thank you for joining me for this conversation. It is a pleasure. This is it's a very important day. A lot of people have unfortunately lost their lives to AIDS and HIV, and we wanted to talk a little bit more about the day as it recognizes the services available as well as those who've died. But we wanted to talk mostly about the various services that you guys provide, especially this new test and treat stuff. I want to know a little bit more about what is available. A lot of things have changed over the past few decades. So can you elaborate more about these services you guys provide?
Sure. Well, starting off with the focus of, World AIDS Day, it's mainly to raise awareness about, the current state of HIV/AIDS, honor those that have died, support for those that are living, encourage progress, celebrate victories, that kind of thing. Um, Test and Treat is a program that I started in 2019 out in Provincetown, and it was nothing that Outer Cape Health Services wasn't doing already. It just made it accessible for those who were either uninsured or underinsured. And what we do is we provide HIV case management. We also provide access to STI testing and treatment, including HIV, Hep C, um, and access to PrEP, which is a pre-exposure prophylaxis for HIV, PEP, which is a post-exposure, and then also we have free supplies like condoms, lube, things like that to help in the prevention.
hmm All right, that is awesome. And I mean, there's a lot of things that I already kind of mentioned earlier, but like these are things that just weren't even available back in like the 80s and 90s and whatnot. So things have definitely changed a lot. Are there some like major strides that you think have been maybe missing from the cultural knowledge when it comes to HIV treatment, especially, or some of these other tools that you've just highlighted? Do you think anything might be slipping through the cracks you wanted to make aware for some of our listeners who might not be available? What's out there?
Yeah, I mean, I think we have come a long way. Back in the day, when HIV, AIDS first started, we didn't have a whole lot. We didn't know what it was, those kind of things. But, now we do things like we test all the blood, so the chance of getting it from blood transfusion is nil. And then back in the 80s and 90s, we had abstinence or a reduction in partners, or we had condoms as the only thing in our toolbox to help prevent. And so nowadays we have a few more things in addition to um, uh, abstinence and a reduction of partners or condom use. We have the PrEP, which is the pre-exposure. We have PEP, post-exposure. And also one of the things that's sort of a little lesser known is, and probably because it's known by a couple different names, we like to give five different names just to make it confusing. Um, uh, U equals U, which stands for undetectable equals untransmittable, which is also known as TASP, which is treatment as prevention. And what that means is that if there's someone living with HIV and they're taking their medication and the viral load is undetectable, meaning that in a sample of blood that we can't detect the virus in their blood, then they cannot transmit it to someone sexually. And so that's another tool that we have, and also very liberating for those living with HIV, knowing that they aren't going to transmit it to someone else if they remain undetectable.
Mhm. Now, you also talked about the case management, but do you think, I assume, hopefully, you guys offer a very welcoming environment and are able to kind of provide emotional support for people who might be kind of first getting into this and maybe their only knowledge was kind of the unfortunate culture surrounding it back in the 80s and 90s. Can you talk a little bit about that kind of personal atmosphere or the kind of cultural things that you try to do to make it a little bit more of a easier process?
Sure. I mean, stigma is very much still alive, and you know, I I don't have the answers for reducing that, except for When people talk about the behaviors that might lead to HIV transmission, I go like, like I don't know if we have answers for um, uh, sexual contact and maybe IV drug use. I think that if we look at a harm reduction model, I think that the good news is that I think that the population is becoming more empathetic. Oops, sorry, phone ring. Empathetic to um, what leads to that, and that also um, sexual activity is a very a normal part of um, life. I'm sorry about that.
That's all
Um,
right. We're calling you live on the
that's
job.
right. My
We
gosh, so
understand
many
that you're
things.
a busy person, especially for the for Outer Cape Health Services.
Yeah.
So,
Luckily, we have some. I didn't ignore it. Someone else is answering the phone. So,
there you go. Good care.
so those people are being taken care of. Uh, so as the stigma reduces, it's less, but it still exists, and so I think that the only thing that we can say that, can be of comfort is um, there's a lot of stigma when someone gets diagnosed. It is um, um, difficult to, especially like, depending upon what's your environment, like in Provincetown, we have a lot of people who are gay and living with HIV, so if there's someone else who, might have gone a different way and it's not part of their community's uh, their community doesn't deal with it very openly like ours might. It's more difficult, and so we try to link people together with different supports. There's some great organizations for women based out of Boston, like Living Positively, I think it's called. Support for those who might not be your quote unquote typical person living with HIV. The good news is that um, medically, if you get on medications, that your body's not fighting it, and that on its own. And so, for your own, there's two different reasons, to get on medications. And one of them is so that your body isn't fighting it and so that it doesn't affect your health, but also it helps you not be able to transmit it to other people. And so there are still a lot of social things, mixed up in that. And so it's not quite as easy as, oh, you just take a pill and it's going to be fine. There's still a lot of social things. There are still, some side effects. The medications are way more tolerable than they were back in the day. But I think like even in my community, there are still people who struggle with it, and so because of fear, and we make certain strides to it, and I think that um, uh, reducing the stigma and as much as we do, like one of the analogies I like to use is if someone's diagnosed with stage 4 lung cancer, let's say two people are diagnosed with stage 4 lung cancer. One person never smoked a day in their life, and the other person smoked 2 packs a day. Are we giving them different levels of empathy based upon that? And so, and also medically, like for myself, I think of, does that affect the way that I treat somebody in the medical thing? And I think that we should extend that into the societal part where I'm not here to necessarily judge someone for what led to that. And so reducing that stigma and reducing, like there are reasons why people smoke. There are reasons why people don't smoke. There are reasons why people might be more sexually active than what someone thinks they should or shouldn't be. So I think that there are things that lead to IV drug use. And I think if we take the um, wondering how somebody got there and just have empathy based upon the fact that they um, have this, because life has taught us that you can engage in the kind of behavior that might lead to this and not get it. And so does that mean that that person is any less judge, because I know plenty of people who have gotten this who would never be in a high risk category. They've gotten it from, someone else. And so it's important to take the stigma out of the diagnosis.
All right, awesome. Thank you so much for joining me for this conversation. It's great to know there's a lot of different services and treatment available, as well as the various support groups that already mentioned there as well. Excuse me. Is there anything else you want to highlight for our listeners while I still have you, either with more where they can learn more online, or just some other like groups involved that you wanted to highlight? Just anything for our listeners.
Yeah. So it's important that everybody gets screened and tested, and so like part of primary care to get tested, once before you're 65. I don't know why you wouldn't afterwards if you never have. But there are a lot of different options, so it's part of primary care. Also, it is you can find resources by even using a search engine and just putting in HIV testing near me, where you can find some confidential places like Test and Treat to do that. There are some over-the-counter products that are available, and you can access some of those a little bit. You can have one mail. There's an organization called takemehome.org where you can order one to be sent to your home. So there's a lot of different ways to be tested in that if it did show positive results, that the medicines can help keep you undetectable so that you remain healthy and unable to transmit it to somebody else.
All right, awesome, Jeffrey. Thank you so much for joining me for this conversation. It has been a pleasure. We'll also have a link as well down below in the description for this video back to the Outer Cape Health Services page on this. So if anyone is interested in learning more, they can see down below in the description. But thank you again for joining us for this piece.
Thanks for having me.
I'm Grady Cullen in the CapeCod.com News Center, and thank you for listening.